welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar. Let's look at today's top headlines. Over 1,000 bogus doctors found in Maharashtra Jalna district. At least 103 bogus doctors and 166 unregistered medical practitioners were found practicing illegally in Maharashtra's Jalna district, an official said on Saturday. As per a report from the health department, the district had 433 doctors, of which 267 were registered and 166 were not registered with the Maharashtra Medical Council, while 103 did not have valid degrees and were declared bogus. These bogus doctors operated in rural areas and slums, endangering lives, the report stated. District Health Officer Dr. Vivek said the health department has initiated action against bogus doctors and unregistered medical practitioners. State Health Minister Rajesh Tope had earlier directed the health department to launch a drive against bogus doctors and illegal abortion centers in the district. Meanwhile, Taluka Health Officer Dr. Sheetal Soni made surprise visits and inspected more than 20 clinics and hospitals in Jalna Tehsil. ICMR NCDC put on alert as WHO confirms 80 monkeypox cases in 11 countries. Issuing an alert to the National Center for Disease Control and Indian Council of Medical Research, the central government has asked them to keep a close watch on the monkeypox situation and send samples of symptomatic travelers to the National Institute of Virology in Pune for further investigation, as more than 80 cases of monkeypox have been confirmed in at least 11 countries. WHO said another 50 suspected cases are being investigated without naming any countries and warned that more cases are likely to be reported. So far, public health agencies in Europe have confirmed cases in UK, Spain, Portugal, Germany, Belgium, France, Netherlands, Italy and Sweden, and also in US, Canada and Australia. Monkeypox is most common in remote parts of Central and West Africa. It is a rare viral infection which is usually mild and from which most people recover in few weeks, according to UK's National Health Service. The virus does not spread easily between people and the risk to the wider public is said to be very low. There is no specific vaccine for monkeypox, but a smallpox jab offers 85% protection since the two viruses are quite similar. ICMR invites applications for clinical and public health research training 2022. The Indian Council of Medical Research has invited applications for the clinical and public health research training program summer of 2022. Candidates who want to apply can apply till 31st May. The main purpose of the CPHRT program is to develop and nurture young physician scientists to improve clinical and public health research ecosystems in India. Students, doctors, researchers, public health professionals who have completed MBBS or are either pursuing or have completed MD, MS, DNB, DM, MCH and MPH courses are interested in undertaking short-term hands-on training for 3 months are eligible to apply. For more details regarding this course, you can check medicaldialogues.in. Citrine to be sold only on prescription of registered medical practitioner. Due to highly tetragenic impact of the psoriasis medicine Citrine, the Ministry of Health and Family Welfare has placed it on Schedule H of the Drugs and Cosmetic Rules 1945, limiting it to be marketed only on the prescription of a registered medical practitioner. The said policy will take effect from November 2022. In India, Schedule H refers to a group of prescription drugs that are listed as an appendix to the Drugs and Cosmetic Rules 1945, which were introduced in 1945. They are medications that can only be purchased with a qualified doctor's prescription and cannot be purchased over the counter. Citrine is a retinoid similar to vitamin A that is prescribed for individuals with extreme psoriasis, a skin condition characterized by swollen, scaly or thickened skin and irregular skin cell formation. Treating sleep apnea can improve memory in people with cognitive decline. There is an increasing recognition of the important role sleep plays in our brain health. Growing evidence suggests disturbed sleep may increase the risk of developing dementia. Sleep apnea is estimated to affect 1 billion people worldwide. In Australia, 5 to 10% of adults are diagnosed with the condition. Sleep apnea causes the throat to close either completely or partially during the sleep. I and University of Sydney colleagues have published a new study showing treating sleep apnea in older adults with mild cognitive impairment can improve memory, but not other areas of cognition in the short term. As there is no current treatment or cure for dementia, increasing efforts have focused on developing novel approaches to slow its progression. Mild cognitive impairment is the stage between the expected cognitive decline of normal aging and the more serious decline of dementia. Researchers believe that this is the optimal time to intervene to help prevent a future dementia diagnosis. Finding new ways to slow cognitive decline in those with mild cognitive impairment is therefore important. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.